Infertility. And I, Dr. Jayanti Kamat, gynecologist for the past 25 years and an IVF consultant, will today be talking about secondary infertility. So in this video about what is the definition of secondary infertility, how many percentage of couples suffer from secondary infertility, and or should we wait, and how long can we wait, what are the treatment modalities, and last, what is how do we prevent or prevent infertility. Now, coming to the definition of secondary infertility is when a woman who has been pregnant before had an abortion or a miscarriage, or she has one child but she cannot conceive again. Now, this is a problem because people have a lot of sympathy with primary infertility, but they do not have much sympathy for secondary infertility, because the general consensus is at least you have one child, at least you have been pregnant before, and you will get pregnant bother. So that's the normal consensus, but this is just a myth. Secondly, it is very difficult for the couple that they have been pregnant or the woman has been pregnant effortlessly in the first pregnancy, and now she's finding it very difficult. So now let us find out what is the percentage of couples who are suffering from secondary infertility. Secondary infertility is found couples, or you can take it as 12.5%. And also, suppose there are 100 patients infertility treatment or who want infertility treatment, out of that 50% of the couples are suffering from secondary infertility. So now the thing is, like, should it be treated or should you wait? And if you wait, how long should you? A woman has one child, and now the general emotional thing about having a second child is every parent feels that we are all nice, and every parent feels that my child should have a sibling. She should have somebody of her own after we are not. That is the emotional thing about it, and every family has the right to decide the number of children or the. So should it be treated? Yes, it should be treated. How long should you wait? Suppose the couple has been trying for a second pregnancy, then the couple can wait for a year. Or if the woman's age is more than 35 years, then even after 6 months of not get success, she should take medical help. Now, what is people ask, why should it get treated? पहला बच्चा तो नॉर्मली हो गया, कोशिश भी नहीं किया था, ट्रीटमेंट भी नहीं किया था, आराम से हो गया, तो करना चाहिए. So remember, there are many factors which cause secondary infertility. First is the woman has aged, maybe at a relatively younger age, and now her age has increased. So as we know, the moment a woman's age increases, produce eggs, the number of eggs as well as the quality of eggs go down, and this impacts her fertility. The second is obesity. If women gain weight, then obesity can be an independent factor which impairs ovulation. Other causes. The other causes are the same as that which cause primary infertility. Suppose the woman has or in the tubes or in the uterus, then she may face this problem. Ovary, suppose she does not ovulate well, she may be PCOS, or she may have developed an endometriotic cyst in the ovary. She has got operated many times. There are so many surgeries which have taken place on the capacity has decreased. Then maybe there are certain conditions. Maybe she when she was conceiving a first child, she may have fibroid or minimal endometriosis, which might not have affected her fertility at that point of time. But now she is suffering from severe endometriosis. So these factors which were at a lesser stage during her first pregnancy have got she has developed newer problems, like she is not ovulating properly, or she is suffering from PCOS. The problem was she may develop after the first pregnancy or after the first child, she may develop blockage in the tubes. Now, the main reason for infection, mostly which is contacted by sexual transmission. And in our country, tuberculosis common cause of tubal block. Or she must have even suffered an ectopic pregnancy. Her tube must have got cut on that particular ectopic pregnancy. So now she has left with only one tube. And this also decreases her fertility status. Then coming to which hampers infertility, which hampers fertility and implantation. Then she may have developed a fibroid, a submucous fibroid which was there before has now enlarged. So all these factors will impair fertility. At the same time, now develop medical conditions like blood pressure, diabetes. So because of this, she is suffering from secondary infertility. Can something happen to the male partner? Yes. Remember, sperm counts do not remain the same throughout life. So whenever we advise a male, just undergo a simple test like semen analysis. So the man suddenly becomes defensive and tells, डॉक्टर मेरे तो एक बच्चा है तो व्हाई शुड आई मेरा तो है एक बच्चा पहले का yes but the sperm count and quality of the sperm do not remain the same throughout life. It could be because of exposure to environmental toxins, or it can be like we are using a lot of gadgets like laptops, and even some medical conditions like hypertension, diabetes can impair male fertility. So the sperm counts could have dropped or dropped. So all these things need to be tested. Now, what are the tests which a couple has to undergo? Suppose they conceived before, they cannot conceive again. So the first will be like the blood test, that which tell us about the general health of the couple. Blood test, then comes the hormonal blood test for the lady, which tell us about her fertility potential. Then comes sonography, any structural defects in the uterus, then checking the tubes. Remember, everything, all information cannot be report. We cannot see tubal blockage in a sonography report. We cannot see endometriosis in a sonographic report unless it has caused a ovarian cyst. So these things need evaluation. So how do we test for tubes? With a woman is advised HSG or hysto self-angiogram. Test to assess whether the tubes are blocked or open. Then histolaparoscopy could also be advised. Histolaparoscopy, if she has a cornual block, if she has a submucous fibroid, or the doctor is suspecting some endometriosis, histolaparoscopy can also be advised. As we all know, histolaparoscopy is the gold standard for testing the reproductive tract. Now, coming to the male partner, of course, a semen analysis is mandatory. Now, what are the treatments? Now, first thing is, like if the woman is obese, she is asked to reduce her weight, and she's her suppose a hemoglobin will be corrected, her sugar levels have got to be normal. So there are various factors which will be looked into. Then the doctor will also ovulation monitoring to see whether she is ovulating properly or not. If she is ovulating properly, then we need to check her or not. As I have told you, hysto self-angiography may be advised or histolaparoscopy may be advised. Then, if this is can give a certain ovulation induction drugs which will cause her to ovulate. It can be coupled with a controlled ovarian treatment modalities like intrauterine insemination. Intrauterine insemination is a procedure where the woman's to produce more follicles by tablets and by injections. And once this follicle reaches the required size, we give which ruptures the follicles to release the eggs. And at the same time, the husband's semen is processed in the laboratory and womb through a small tube. This is called as intrauterine insemination. Now, this can be tried depending on for maybe 4 to 6 cycles. Suppose this is also not successful, then we have to go to the next modality, on a higher modality of treatment, or commonly known as test tube baby or in vitro fertilization. Here we again give drugs and to the injections to the more number of eggs. These eggs are taken out of the body by sonographic guidance, and then these eggs are and the fertilized eggs form embryos, and these embryos again placed in the womb woman. This is called as IVF. Another procedure is called ICSI. If the male semen count is very low, then a procedure can called ICSI or intracytogen can also be done. And of course, there are many other higher options. So, this in short treatment about secondary infertility. But remember one thing, the message which I want to convey is, if a woman is planning, if she's unsuccessful in doing so, please, please, please take medical treatment. Do not delay it. The moment you delay it, it increases and then everything gets complicated. So, what is the prevention? Prevention is like, as I always say, we plan so many things in our life. Career also has to be planned. Pregnancies need to be planned, they cannot just happen. So, after the first child, try to conceive the first year age. Then you can have a normal spacing of 2 to 3 years and then think of a second pregnancy. Always second pregnancy to be before the age of 35 years if it is uncomplicated, if you do not have any other problem. Short about secondary infertility. So, any questions? Any questions? Yeah, can you please show me the questions? Can I see the questions? Yeah, somebody has asked, does PCOD affect my second pregnancy? Okay, now if you're suffering from PCOD for a long time, and if you're planning to conceive, your PCOD may affect or may not affect. If it is in control, it may not affect. But suppose you're overweight, you're getting irregular menses, then the red flag, and where you should seek treatment. So get your PCOD treated. If you have to be regular, and your PCOD has to be treated if you want a second child. Yes, can I see the questions, please? I cannot see the questions. Naina, please, can I see the questions? So, if they suspect secondary infertility, so now if the woman's age is below 35 years, they can wait for 6 months to try. And of course, I forgot to mention, frequency of sexual intercourse is very, very important. What I have found out is couples who suffer, the frequency of intercourse is very less. So that also has to be looked into. Maybe because they are busy with their respective careers in managing the home and the child. So the couple can wait for 6 months to 1 year. If they are not successful, it's always better as early as possible. Yeah, next question. Can I see the questions? I think there are a couple of questions, but I cannot see them on the board. Okay. Yeah, Prachi, you asked me, are the causes of second woman or the man? See, it can be in anybody or it can be in both. Okay, so both the partners have to be evaluated. I have already mentioned this. It's not right. Okay, it takes two hands to clap. So both the partners have got to be evaluated. It's not that you investigate the woman and you don't investigate the. For the male partner, there's a very preliminary simple test, and that is semen analysis. So both partners need to be evaluated. We do not know where the problem lies. Yeah, rather you have said it's been 10 years and now I'm 40. Should I try for second baby? What I need to take care? Rather, I think you're a little late because, as I said, after 35 years, it decreases. So, since you're now 40 years, you first get your fertility assessment done, whether you can have your own child course of action. But for you, the time is very short. You have to take action immediately. Sure, you have asked me, Doctor, C section effect to secondary pregnancy. Okay. No, previous C section or normal affect your fertility. It is just the mode of delivery of the child. So that just by having a C section in the previous pregnancy cause a problem in the second pregnancy. No. How? What is the frequency of intercourse? Yes, frequency of intercourse at least thrice a week. That's how we say. If you're planning to conceive, Padma, you have asked me the age gap between children. Now we say it is 2 to 3 years because the first child needs attention and the woman needs to recover from a take care of the first child. So usually we say it is 3 years, minimum 2 to 3 years. Mahadev, you have asked me what are treatment options for secondary infertility. I think I have covered this in detail and on what is the cause of the infertility and uh, age of the woman and other things. I have covered this in detail in my video. Yeah, any takeaway message, as I already said, like uh, try to conceive at a younger age, whether it's your first pregnancy, try to conceive at a younger age. Don't keep on postponing uh, pregnancy. I've seen many couples, first of all, in today's world, everybody gets settled. So marriages itself are at a later age. Like people get married in their 30s. And after that, again, they postpone childbearing for another 2, 3 years. Then again, the second child will come even later. So try to plan a pregnancy as early as possible. Because even with treatment becomes at a later age. Yeah, I think we are done with the questions. Thank you, friends. I hope you like follow me on Baby Chakra. Thank you.